very common is the simple answer to that. Is absolutely common, and there are a couple of different reasons. One of them is, of course, when you're on your period, what is happening is that menstrual blood or menstrual products actually is from the effect of your hormones, estrogen and progesterone during the cycle. You know, the womb was being prepared for the possible pregnancy. So the womb was getting thicker, the blood vessels were increasing, but pregnancy didn't happen. And so you have a period, and that's the period itself is all the components of the womb and the blood vessels and all that. They were trying to get ready for a pregnancy that didn't happen. So now the womb is trying to evacuate all this material from itself. And so it is cramping. So there's a lot of cramping going on. And so what will happen is that while the womb, remember that the position of these organs are so close to each other. You have the bladder in front of the womb and then the rectum and the anus behind the womb. So while the womb is busy sort of contracting as it's getting rid of this material, of course, that can relate or refer to the bladder. And so the bladder itself might just be a bit irritated because of this movement and muscular activity going on behind it. So that's one reason, simple science behind it. But then, of course, the other thing is the hormones themselves, progesterone and estrogen. You're at that stage during your cycle when their levels are quite low. Now, progesterone itself is the hormone that contributes to making you feel bloated, and so during the days just before your period, you are accumulating fluid thanks to progesterone. Now that the progesterone levels are dropping, your body is now just going to release all the excess fluid, and part of that is through urine.